Being able to use the 4Ms as a framework is a way for us who are loving and caring for older adults to make a big difference. It's a very complicated process to take care of an older adult, whether you're in the healthcare field or you're a family member. And by using the 4Ms and starting with what matters, we take what that individual needs and wants, and then we can work through the other 4Ms using that framework. So what matters helps us connect our patients to the healthcare providers as well as other community organizations by focusing on what matters to the patient. When we understand what they want and need, then we can collaborate and deliver the care and the services that an older adult needs. And I think that helps eliminate frustration, and I think frustration is on both sides. On the side of the patient, they're being forced or pushed to do things they don't want to do, or they're getting a lot of information that they don't understand or can't process. On the other side, the caseworker or the healthcare providers are trying to get all the information they can into the patient's life to make it better. And we can't understand why they can't process it and do what we ask of them. So if we keep going back to what matters to the patient and build on that, again, we get much more successful outcomes. In a personal way, the 4Ms have impacted my ability to care for my aging adult parents. I was from the healthcare field and often tried to push what I thought was important, and it didn't always go well. They didn't respond to what I thought they should or could do. But when I started to listen to what mattered to them, I could meet them where they were, and we have a much better relationship, and they're much healthier and much more happier. The most challenging thing I think that we face in federally qualified health centers when delivering care to the older adults is the time frame that we have allocated to deliver services. So we have to do a lot of things in a short amount of time. There's a business aspect to this. Another part that's challenging for a federally qualified health center is capturing what matters in the EMR. There isn't a special place right now in our electronic medical records for us to capture that and then be able to really quickly go back and reflect on what matters to the patient and tie that into the other 4Ms. We're continuing to work with our EMR company to make that better. A big thing for us was the cultural shift. Our staff has intuitively been empathetic and sympathetic to the needs of the older adult, but we haven't really been able to focus and capture specific things and deliver the care in the what matters concept. By starting to talk about it in the 4Ms framework and start again with what matters, our staff is listening better and hearing what the needs are, and then we can make better connections to different services in the community. We can help family caregivers deliver better care at home. And another important piece is to listen to what the family caregivers need so that we're taking care of the caregiver as well.
She was always there for us. I played sports and things, and she would always, try to be there for the games or whatever. Very kind, loving woman. She worked at Valley View as a CNA. She went to the adult daycare center before they closed it, and she enjoyed it. They did a lot of activities, but I feel that she enjoyed it because she always was like asking if she could help the other people that were there. I first found out about the age-friendly care from the newspaper. I was going to go. I asked my brother if he would like to go. I really wanted him to go to see what it's going to be like through the stages of dementia. So we both went. Very good program that I would recommend to anyone. The speakers are awesome. They have a lot of knowledge on the subject, and I think like even doctors should be knowledgeable about the subject. It's important because it's all about the relationship. It's not about who's right or who's wrong. It's to have her to have the best life that she has left. Well, focusing on what matters, my biggest thing is safety for her, to keep her safe and to make her feel like she's still part of the family, and to not try to talk down to her. I know sometimes we do, but we try to keep it on a level that she's able to understand and treat her like a real person, because she still is. Very funny. She has a great sense of humor when she's in a good state. We sing, we dance. How much I love you, please don't take my sunshine away. My thought is, if I was sick or in an accident, she would have been there for me. So it's not hard. I don't see it as a burden because she's my mother. We took her off some of her night pills because we found out she's more alert instead of sleeping all day long. So after breakfast, it's usually like watching TV for a little bit, or if we have to go on an errands, we'll take her on an errands. It all depends how well she's walking, how much she does. But we've taken her to the grocery store together. Because of breaking her her elbow, I'm sorry. It was just my brother and her, and she must have let go when he went to pay, and she fell. The one technique we try to use is say, "Can you help me?" Like if I'm giving her a bath, I'll say, "Can you help me sit down for me?" And we use hand signals on a couple things that we do with her. Before, sometimes we'd say to her, "Now you can do that. Pick up your spoon or pick up your fork and eat your food because we know you can do that." And then we realize on some days she can't do that. So then we feed her, whether it's my brother or myself. There's one thing that we usually don't have to feed her, though. Applesauce. After she eats her meal, we can give her a bowl of applesauce, and she can pick up the spoon, and she can eat it herself. But we had to feed her main meal. Or she can pick up a piece of candy or a cookie. So it's just those few items that she loves and always wants. She doesn't seem to have a problem eating those things. Yes, I feel that the techniques do help me and my brother take care of my mother. Like I said, we don't always use them because we get frustrated at times, which would be normal. And then we apologize. But the techniques are very helpful. Maybe later on we'll play this game. You remember the game? Trouble? Are you Trouble?
No, I thought it was you.
Oh, you thought it was me. Well, thank you very much.